Hey there, first of all I wanna wish my most awesome friend anti-bullshit man happy birthday. And since I didn't get him anything, I'm gonna ask all of y'all to go to his channel and wish him happy birthday as well, because, well, everybody knows that spam is like the best birthday present ever. Now onto the video. I was reading this article from a few months back about pregnant women being given dexamethasone, which is a risky classy steroid aimed at female fetuses that may have congenital adrenal hyperplasia or CAH. If you don't know what CAH is, basically the adrenal gland doesn't work properly in producing cortisol, which is a hormone essential to maintain life. So this is a life-threatening condition, and there is no cure for it. The people affected by it will need treatment their entire life. Okay, so about the female fetuses, unborn baby girls being treated in their womb with dexamethasone. This is actually an off-label treatment that some doctors will recommend in order to prevent some of the symptoms that may later occur. And all these symptoms are related to the girls developing to be too masculine. This can mean a more manly figure, deeper voice, and ambiguous genitalia. The genitals look more mannish. The internal organs are fine, everything functions normally, but the aspect of it is ambiguous. Okay, so what's wrong in preventing this if possible, right? First of all, this is an inherited condition. If you have it, there is 1 in 8 chances to pass it on to your child. Now, the treatment with dexamethasone must begin as soon as the woman knows she's pregnant, which is several weeks before she can know if the fetus is in fact a girl, and before it can be tested to determine if it even has the disease. Now, if after the testing the baby is proven to be healthy, the treatment is stopped immediately, but this is after the fetus has already been exposed to the drug for weeks, which means that out of 8 fetuses, 7 of them will be treated with dexamethasone even though they are perfectly healthy. Again, 7 out of 8 children will be unnecessarily exposed while in their womb for weeks to a risky steroid that has not been properly tested, and the long-term effects it has on humans are not yet known. I'd say that's a problem. Secondly, this treatment only addresses the problems of aesthetics and physical appearance. It does not cure the disease. It does not improve the health. It does not replace the medication that will be necessary throughout their lives. It is only meant to prevent the girls from becoming too androgynous, or even worse, lesbians. Pediatric endocrinologist Maria New of Mount Sinai Medical Center in New York, who has long promoted this treatment, and her collaborator, psychologist Meyer Bellberg, have been researching this for quite a while and published a number of articles on this matter, in one of them stating that in the case of women with CAH, and I quote, "The rates of bisexual and homosexual orientation were increased above controls and correlated with the degree of prenatal androgenization." They concluded that the treatment may prevent such horror from happening, and not just in the case of sexual orientation, but also behavior. Long-term follow-up studies of behavioral outcome will show whether dexamethasone treatment also prevents the effects of prenatal androgens on brain and behavior. But what is it that must be corrected in the behavior, you may ask? I hope you're ready for this. CAH women as a group have a lower interest in getting married and performing the traditional childcare/housewife role. As children, they show an unusually low interest in engaging in maternal play with baby dolls. Their interest in caring for infants, the frequency of daydreams or fantasies of pregnancy and motherhood, or the expressed wish of experiencing pregnancy and having children of their own, appear to be relatively low within all age groups. Do I even need to say what is my fucking problem with this? And just in case you haven't heard enough wisdom from Dr. New, here is more. The challenge here is to see what could be done to restore this baby to the normal female appearance, which would be compatible with her parents presenting her as a girl, with her eventually becoming somebody's wife, and having normal sexual development, and becoming a mother. And she has all the machinery for motherhood, and therefore nothing should stop that. Beach goes on the same note in a paper published this year within the New York Academy of Sciences. Gender-related behaviors, namely childhood play, peer association, career, and leisure time preferences in adolescence and adulthood, maternalism, aggression, and sexual orientation become masculinized in girls and women with CAH. These abnormalities have been attributed to the effects of excessive prenatal androgen levels on the sexual differentiation of the brain and later on behavior. We anticipate that prenatal dexamethasone therapy will reduce the well-documented behavior masculinization. This treatment is not meant to treat any health problems, but simply to prevent the girls from developing into women that don't own up to the social standard of what a woman should be like. You know, feminine and delicate, obviously heterosexual, oriented towards woman-like careers, in need of a husband and wishing for children. Anything that doesn't fit into this model is therefore abnormal and needs correcting. I know many people say that if we can use science to improve our lives in whichever way that may be, we should do it. I mean, statistically speaking, being straight, you have more chances to find a partner, less chances to be subjected to bullying and social stigmas. Generally speaking, your life is easier, which is true. But the same can be said if you are white, if you are thin, if you are tall. The solution is not for everybody to modify themselves and their children and try their best to fit a standard. Because as long as there is a standard, there will be people marginalized and suffering because of it. The solution is to break the standard, to accept that people are different. Girlish boys, manly women, gays, lesbians, bisexuals, transgendered. Your value as human beings does not lie in such things, and nobody should convince you otherwise.